So this lecture is on adhesive capsulitis, otherwise known as frozen shoulder. So adhesive capsulitis is generally idiopathic, but can also be post-traumatic or post-surgical. And the pathophysiology of adhesive capsulitis is it starts off as an inflammation, which then results in reactive fibrosis and adhesions, which leads to the thickened capsule. The diagnostic criteria for adhesive capsulitis is a painful, stiff shoulder for at least 1 month with no osteoarthritis changes on X-rays. This is loss, which is loss of joint space, osteophytes, subchondral sclerosis, subarticular cysts. There are some risk factors for adhesive capsulitis, which involve being female, diabetes, thyroid disorders, trauma, and Dupuytren's, so generally autoimmune conditions. So symptoms involve the first 6 months, which is severe pain and increasing stiffness, and it's the worst part of the patient's journey usually, and this affects their ADLs. The next stage is frozen, where the stiffness is still there but the pain gradually improves, and finally the thawing is the last stage, where the pain and the stiffness gradually improve. These are generally the 3 phases of adhesive capsulitis. So as with any condition, it is important to take a thorough history and examination. In the history, it's important to ascertain whether there is previous trauma, previous surgery, or any of the risk factors that we outlined before. It's also important to know the duration and nature of the pain and stiffness, so whether it's insidious or sudden onset, to differentiate from other conditions. In the examination, both active and passive range of movement are equally reduced, as with osteoarthritis. However, external rotation is usually the most affected in adhesive capsulitis. It's also important to do a screen of other joints, including cervical spine, contralateral shoulder, and the distal upper limb. After history and examination, we move on to imaging, which is important to get an AP and lateral X-ray. This is to rule out osteoarthritis. We can also do an ultrasound and MRI if we're concerned about any cuff pathology. And finally, bloods, if we feel any risk factors are present, such as diabetes. So treatment options for this condition follow treatment options for any other surgical condition, which is conservative medical surgical approach. So we start off with conservative, which is education about the condition and physiotherapy. The medical approach, which is analgesia, such as NSAIDs, and more invasive analgesia, such as intra-articular steroids or hydrodilation, which is injection of a high volume fluid to make the capsule and effectively tear the capsule. And finally, surgical, which is manipulation under anesthesia or releasing the capsule arthroscopically. So in summary, adhesive capsulitis is a painful stiff shoulder with no osteoarthritis and can be treated conservatively, medically, and surgically. Thank you very much.